Vaqueros, this week we're going to discuss group treatment. This is out of chapter 8 from the textbook, so we're going to discuss how effective group treatment is and a couple of underlying theories about group. So, what I mentioned last time about individual counseling and how that's really uh, kind of not done as often anymore, it still is, but not as often, it's because of group counseling. So, group counseling is actually, in some cases, the preferred type of counseling for a couple of reasons, mostly because it is cost effective. So, you can see right there in the middle. And what exactly that means is that it is actually a lower cost, but mostly dictated by insurance companies and payers to do group counseling on several people at the same time, like several clients at the same time, than it is to do individual counseling one on one. It kind of saves time, it kind of saves a little bit of money. But group counseling, whatever your thoughts are about group counseling, it does work. It is very important to know that. So, as a counselor, I guarantee you will spend a majority of your time facilitating and leading group counseling sessions. And it's nothing to be intimidated about. It's actually a really, really enjoyable experience for everybody. There's different types of groups. All right, so let's be aware of what they are. Open groups are group settings, groups where people can come in and start right away. Different people start and stop at different times. Closed group is when people begin at the same time and end at the same time. So it could be over a matter of weeks, it could be over a matter of months, but the same group starts at the beginning and ends at the end. Psychoeducational group settings, that's when people will usually just receive information and education about addiction. So this is more of like a teaching group where it's like a class, some people refer to, where they'll just learn about substance use. Self-help groups are um, run by people who are in recovery themselves. The best outcome, of course, is matching the type of client to a specific group. It depends. Most programs, so let's say, for example, like a residential rehab program, they'll probably implement all these different types of groups. So I've worked at residential programs where we had group psychoeducational group times. We've had open group times. We've had self self help group times. All right, so you'll need to know this because these are the therapeutic factors for people who are taking group counseling. And what do they get out of it? So all these different therapeutic factors are in the textbook, Yalom. It's a big name. You'll need to know Yalom in case you all ever plan on someday taking your licensing exam to become a substance use counselor. I guarantee you this name Yalom will be on the exam. So here are all the different benefits, therapeutic factors. This is what people get out of attending group counseling. All right, so there are a couple of what these curative factors, therapeutic factors, kind of the same thing, grouped into separate categories. We can go through each one of these. Interpersonal input is, getting feedback from other group members about an issue. Catharsis is kind of just a release, kind of a letting go, emotional release about an issue. Cohesiveness is the feeling of belonging, a sense of being together. Interpersonal learning, it's kind of like educating each other, learning from other people's processes and mistakes. And of course, at the bottom, what else do you get out of a group? Talking about things together, warmth, empathy, and support. So back in the chapter 7, when we discussed individual therapy, we talked about the stages of change. This is also mentioned here in chapter 8 as well. So remember the stages of change. There's 5 stages of change: contemplation, preparation, and action, maintenance. Actually, they would look like this: 80% of people who come in are going to be in either pre-contemplation or contemplation. So it's not going to be an exact representation. There's going to be not a lot of people that are in preparation. They're going to be more in pre-contemplation or contemplation, which, remember, it means that they might not really want any help. They might not be ready for the help. They might not be willing to want to get the help. So when groups form, there's a section that discusses how they develop. So what happens? All right, so there are all these different stages, and I would want you to know them because I relate this back to, for example, like in your courses. I'm sure a lot of times you have to do group work, or you're assigned into groups to complete a project or an assignment, a presentation usually. I know because you're mostly made to do things like that. So forming the group is getting to know each other. Either you have the decision to form the group or it's made for you. So that's the first stage. The second is initial group stages. So that's group orientation. That's kind of formally or informally determining what the rules are, what are the norms. Transitional stage. This might happen if there's problems. So what's happening? Are things being done or things being not done? So again, remember back to whenever you've had to do group work or group assignments. What exactly is being done? If things need to change, it usually might happen at this stage. The working stage is when things are actually getting done, and then the final stage is termination, when things are over. So what kind of group counseling is typically done? What kind of techniques are done? Well, 12-step seems to be the most common. 12-step is like a support group, like AA meetings, that's 12-step. Cognitive behavioral therapy can be done in a group. Motivational interviewing. Again, motivational interviewing was a big part of chapter 7, big part of what we discussed before. It's about increasing somebody's motivation to get help. That can be done in a group also. I'm going to give you an example. Those of you, if you ever want to work with teenagers, there is a kind of a manual, kind of a curriculum I'm about to show you, which integrates motivational interviewing with cognitive behavioral therapy, and it's targeted towards adolescents who smoke marijuana. And family and couples group counseling can be done also. So right here on the left, this is the name of the manual, and I might have this posted up in our folder. It's free. You can download this and you can use it. It's if you all ever work in a program with teenagers who use marijuana, use this. It has all the different work activities and techniques in there. It's called cannabis use treatment. So it works really well. So remember the continuum of care goes from prevention, detox, to outpatient. Groups can be used in prevention to develop new skills so people won't. Prevention is about stopping the use of drug use before it happens. So a lot of this is information based. Detox, and inpatient treatment, residential treatment. Again, it's the beginning, it's not the end, but it can be done in groups as well. So residential treatment, which I mentioned earlier, there is a lot of group sessions done in residential treatment. It's mostly what's done throughout the day. Uh, I'm going to go ahead and skip all the way down to the bottom. Outpatient groups. A lot of times, people coming out of residential go to outpatient, or people might just start at outpatient uh, rather than residential. Depends on whatever they need. But yeah, there is a lot of group sessions that go on in outpatient. Um, most outpatient programs do group sessions like maybe 2 or 3 times a week for a couple of hours. So I told you group treatment works, and it does. However, there is no conclusive evidence that group therapy is more effective than individual therapy. It just depends. It works, but not better than individual. But it works, can work just as well. But the important point is down at the bottom, where group counseling is mostly done as an approach to save time and to save money. And unfortunately, that's really what is important to a lot of programs, because time and money are both limited.